walking together on this journey. All paths lead to home.
Dr. Ash Lawson is a representative of Canadian Association of Physicians for the Environment, or CAPE. And as a very recent graduate of UBC's Island Medical Program, yay, a new doctor.
Hello everyone, I am here today to commemorate the lives lost during the 2021 Heat Dome, to speak about the health impacts of climate change driven by burning of fossil fuels, and ultimately what we can do about it. 5 years ago, I was working in Vancouver's downtown east side. During the Heat Dome, I saw firsthand the devastating impact extreme heat can be on vulnerable community members. In an inner city with limited green space and few accessible buildings with AC, a haze gathered. It shimmered over the pavement, and it made the air heavy and oppressive. Those who could left their homes, their shelters, their tents, searching for a way to cool down. I saw people passed out from the heat in their tents, elders ousted from their stifling apartments without cooling, and workers struggling to help others despite their own heat exhaustion. Makeshift misting stations and cooling rooms were life-saving for those who could get to them. Over 600 people lost their lives in BC during the Heat Dome, and 22 of those were here in Victoria. The overwhelming majority, 98% of these deaths, occurred indoors in people aged 70 plus. No one should be forced to overheat in their own home. As a recently graduated doctor, I know my practice will be shaped by the rising impacts of climate change, which is serving to increase both the frequency and severity of extreme weather events. A comprehensive study of the 2021 Heat Dome concluded that this heat would have been impossible without climate change. They found an event of this magnitude was currently estimated to occur once every 1,000 years, but in a world with only 2 degrees of warming from climate change, it would occur roughly every 5 to 10 years. Western Europe is currently experiencing such an event in the form of a deadly heat wave, and here in BC, we continue to see preventable deaths occurring in times of extreme heat. Those who are most vulnerable are those who are elderly, have mobility concerns, those with mental health and chronic health diseases, who may not be able to notice that they are overheating. Here today, we have an obligation and an opportunity to learn from our experience and advocate for changes to limit the influence climate change can have on our health and well-being, as well as prevent needless loss of life when the next extreme heat event arises. First and foremost, the Canadian Association of Physicians for the Environment call on the BC government to transition away from the use of fossil fuels, the major driver of climate change. And invest instead in renewable energy, which is cheaper, cleaner, and safer for both public and environmental health. Thank you. On a municipal level, there could be bylaws limiting the maximum indoor temperature that Victoria is already starting to explore, and expanding cooling green spaces within the city to add protection for our more vulnerable community members. We grieve the lives lost in the 2021 Heat Dome, and when the temperatures rise again, I urge you all to take care of yourselves, take care of each other, work with local communities, neighbors, to find and support isolated and vulnerable people, including seniors, during times of extreme heat. As individuals, we have the power to make a difference through advocacy, education, and compassion. Victoria is a strong and deeply caring community. I've seen it in my past 4 years living and training here, and I see it today. Thank you for your care.
For our children. Walking together on this journey, all paths lead to home, where you never have to be alone.